St Vincent's has been involved with tinnitus for many years. So first I'd like to talk about a little bit about the history of tinnitus. The first mention of tinnitus was found on a Babylonian clay tablet somewhere between 2700 BC. Also ancient Egyptians. There's mention of ancient Egyptians and tinnitus. But what's interesting about all of this is the descriptions of tinnitus depended on cultural factors, so that some cultures regarded it as a sensitivity to the divine or God talking to them, which is a novel way to look at it. The famous ones. Over the decades, there have been famous people who have been reported to have tinnitus. Beethoven developed hearing loss and tinnitus at only 29 years old, probably from lead poisoning. Charles Darwin kept a record of the amplitude and frequency of his tinnitus. Vincent van Gogh suffered from unilateral tinnitus and is reputed to have cut off his ear because of it. And in modern times, many musicians, for obvious reasons, including Clapton, Dylan, Neil Young, Fleetwood and Sting, have all reported having tinnitus. So the big question, where is tinnitus generated? It used to be thought that tinnitus came entirely from the cochlea or inner ear, but we now know that's not true. So I guess you all know where the inner ear is after Nigel's talk. It's the snail shell over there on the right-hand side of the slide. It was thought that the tinnitus was generated in the hair cells, and this is an electron microscope image of healthy hair cell receptors. So this is where we used to tell people that tinnitus was generated. We'd say that these had been damaged and as a result they'd developed tinnitus. However, this is not the full story. And how we basically came upon this is because of the results of surgery. Tinnitus can be caused when acoustic tumours are removed, which results in cutting the auditory nerve, and that used to end up with many patients having tinnitus. Also, back a few years back, there were cases where people with tinnitus had their auditory nerve severed to eliminate tinnitus. However, in most cases, this was not very helpful. And often if this then resulted in them losing their hearing, and the tinnitus would probably have been worse. So this then implicates the central auditory brain structures as being at least part of the tinnitus story. So we need to then take into account the whole auditory system, and you can see it here. There's a couple of illustrations here of the auditory system, starting at the ear and cochlea and travelling up to the auditory cortex. So, chronic tinnitus is probably dependent on changes occurring at more than one level in the auditory system. So realising that the brain was connected to the generation and maintenance of tinnitus was a milestone in tinnitus research. So it wasn't all coming from the ear, it was coming from the whole auditory system, possibly. This led to research into the changes in the auditory pathways that possibly existed in tinnitus patients. When research was done into these areas, abnormalities were found. For example, the auditory cortex is found to be more active in tinnitus patients, an increase in spontaneous firing rate. This led to the idea that if this hyperactivity could be reduced, then there should be a decrease in tinnitus perception. As a result of this, new treatments are being developed on this idea. This may not be the whole story, but this is to give you some idea of what's possible. A second milestone in tinnitus research, recent studies suggest that it is not only the auditory system, but also the non-auditory areas of the brain which are involved in processing sound from the outside and the inside, external sound and tinnitus. Most patients with tinnitus are able to change the sound of their tinnitus by moving their neck or head or jaw in certain ways that they know changes their tinnitus. And this is one of the reasons that this area was investigated. Who here, if you wouldn't mind, put up your hands, who here has tinnitus? Put up a second hand if you know you can change it. Not so many people. So, the latest ideas. The idea is emerging that we should not just concentrate on each area of the brain separately, but focus on a tinnitus network of auditory and non-auditory areas which influence each other. Now, I'd like to talk to you about human brain mapping of tinnitus. This is some work being done at Macquarie University, and they have very kindly given us this information and images. So there's some images up there. There's 4 different images of control groups and of a tinnitus group. There's about 10 in each group. And so if you're looking at these slides, you can see on the right-hand side in particular, down the bottom, the red area is much larger than the control group above it. And this is showing, the authors are interpreting this as being a MEG result, which indicates an increased firing rate in the auditory neural network in the tinnitus group. So they're saying this shows a distinct difference between the control and the tinnitus group when measuring using MEG, establishing it as being a promising tool for identification of tinnitus objectively. Now I'd like to have a quick run through of the treatments, different treatments. Firstly, treatments that don't work. Treatments that promise you a cure generally don't work. Ginkgo biloba has been talked about for many years. A study in 2012 using control groups showed absolutely no benefit. Circ, on the whole, is not beneficial to tinnitus patients. It's also mentioned, we've also had a lot of inquiries about low power laser therapy. So low power laser therapy, a study was done in 2013 that looked at 5 different measures and found absolutely no changes on any of those. Sound therapy is another suggestion that's used for treatments for tinnitus, can be very helpful for managing tinnitus, but does not provide a cure. Combinations of minerals and vitamins that claim to cure, such as Quiet Us, we found these on the internet. They all offer a cure for tinnitus. Obviously, this is not going to be the case. So beware. We found it very difficult to determine exactly what products are in these formulas and how they're meant to help you. Future treatments. Therapies which target the activity in the auditory cortex. For example, repetitive transcranial magnetic stimulation, vagus nerve stimulation paired with tones, different drugs. All of these things that target the activity in the auditory cortex are possibilities in the future. which only time will tell whether they have any impact on tinnitus treatment or not. At the moment, what is the best current treatment pathway? A full audiological assessment, followed by an ENT specialist if suggested. A discussion with your audiologist or specialist about your individual hearing loss, your individual lifestyle, and how tinnitus is affecting you. We need you to investigate tinnitus retraining therapy and/or cognitive therapy. If you have any hearing loss, you need to consider using hearing aids and/or some other form of sound therapy, such as neuromonics. Thank you.
And we really, at this stage, don't have enough evidence to say that there's this one therapy that can really cure tinnitus. Now, most of my clients with tinnitus are very disappointed when they hear this, and it's understandable why they would feel that way. However, today I would like to talk a little bit about tinnitus retraining therapy and psychological management for tinnitus that has been shown to be most helpful for people with tinnitus. So when people come to our Centre for Tinnitus Management, usually the first thing that we suggest is for them to have their physical side of things checked. So we usually suggest them to have a hearing test with an audiologist, perhaps going to the GP for a general checkup, and if necessary, going to an ENT specialist for examination. And if there's nothing that was found that could be done to remove or to reduce tinnitus, then we can consider what we can do to manage the tinnitus. Now, just like with all medical conditions, we understand that psychology plays a huge role in the management of the conditions. A lot of physical things are actually hugely influenced by psychology. Now, a good example will be the perception of hunger. Is it physical or psychological? Have you ever had the experience of not having had much to eat the whole day, but because you are so worried or even excited about something, you just don't feel like eating at all? Okay? How about the example of sleep? Is sleep physical or psychological? I would say both. Have you ever had the experience of, physically being very tired, but because you were so worried about something, you barely slept for the whole night? So these two examples shows that psychology plays a huge role in the management of a lot of physical things. So going back to people with tinnitus, even if the onset of tinnitus is not triggered by psychological reasons, but if you're highly stressed or anxious about your tinnitus, this psychological state could further make your experience with tinnitus worse. So the goal of the therapy is not to remove or reduce the volume of tinnitus, but to reduce the negative emotional and functional impact of tinnitus. And in therapy, we use the term habituation to describe this. So what is habituation? Habituation is that the sound of tinnitus is there, but it does not really make you feel frustrated or angry or anxious. It does not interfere with your everyday life functioning. It's in the background, you can shift your attention away from it, and it's not a problem for you. Now, we all have the ability to habituate to things. We all have ability to habituate to sounds, or in fact, all the sensory things that we have in our everyday life. In fact, we have already habituated to a lot of things. Now, if I ask you, how does it feel to have your feet in your shoes? And we start to feel the sensations. And you start to feel the texture of your socks or your shoes. You feel the temperature of your feet. You feel how loose or tight your shoes are. Or maybe you start to feel, oh, maybe my feet is a bit dry or clammy. Now these sensations are there all the time. But apart from now that we have drawn special attention to the feet, you actually didn't really notice them that much the whole morning. In fact, you usually, I guess, don't go through your day feeling these sensations or thinking about these sensations. So going back to tinnitus, now we want to use this ability to habituate and apply this onto the management of tinnitus. And in order to achieve habituation, in therapy we use tinnitus retraining therapy and a psychological management approach called cognitive behavior therapy. Imagine all the sounds that we are exposed to every day. If I give you a task of listing out all the sounds that you have been exposed to today so far, you are probably really going to struggle, because we are exposed to an incredible amount of sounds every day. Now think about it. When you walk down the street, there will be the sounds of your footsteps, there will be traffic sounds, there will be people talking in distance, there may be a dog walking by, the sound of birds, the wind, the trees, the music from the shops, cafe waiter cleaning the table, all these sounds. I can go on and on and on. Now, even though we expose to a lot of sounds, and some of the sounds could actually be quite loud, but because we treat them as normal, we accept these sounds, therefore our awareness of these sounds will not be very high. So this is very important to know in the management of tinnitus, that our brain does the filtering of sounds. In contrast, for sounds that are very special, that are very meaningful to you, you're probably going to have higher perception of the sounds. I don't know whether you have the experience of, let's say, going to a party and you see someone there, you start talking and you're engaging in some sort of interesting conversation with the person. And then you hear someone saying your name somewhere. The voice may not be loud, but you can just pick it up and you go, who's talking about me? Now this is telling us that our perception of sound does not only rely on the intensity of the sound, but more importantly, the meaning of the sounds. So if a sound is meaningful, we perceive it more. If a sound is less meaningless, we perceive it less. Now for someone who is bothered by tinnitus, tinnitus will not be something that's trivial and doesn't matter. It will be something that's actually quite special and quite important. Therefore, it's understandable that the person will probably have more awareness and perception of the sound. So in the therapy, what we try to do is to retrain the brain to become more neutral towards tinnitus so that the perception of it may reduce. Part of the tinnitus retraining therapy involves using of sounds. We know that it's natural for people who have tinnitus to hear tinnitus more when they are in a quieter environment, simply because there's no diversion for the brain to perceive. So using constant neutral sounds such as rainfall sound or water sound, white noise in the background could reduce the difference between tinnitus and the low background sounds, so that it makes tinnitus less in your face, and it could facilitate the habituation of tinnitus. Now, complementing tinnitus retraining therapy, we use cognitive behavior therapy, and it helps to reduce the negative association with tinnitus. When someone has tinnitus, it's not uncommon for the person to have a lot of negative thoughts or worries about tinnitus. And we know that when you have a lot of negative thoughts, then there will be a lot of negative emotions such as anger, sadness, anxiety, or frustration. Now, the more of these emotions you have, the more likely you are going to focus on your tinnitus and therefore perceive it more. So this is like a vicious cycle that can actually maintain the high awareness of tinnitus. So in therapy, we look at identifying the thoughts that we have for tinnitus. My experience is that once we start to look at these thoughts, we often find that a lot of these thoughts are actually unrealistic worries or biased negative thoughts. So in therapy, we work on challenging these thoughts and replacing the negative thoughts with more helpful, realistic thoughts, which will then lead to less negative emotions. Now, a lot of people who have tinnitus describe to me their tinnitus this way. They will say, I hate my tinnitus. Since I had tinnitus, I've been having a lot of problems sleeping, I can't concentrate properly, I don't seem to be able to relax and enjoy things as much as before, and I just don't feel like going out to do things or even just socialize with people, and I get so easily irritated all the time. Gosh, isn't tinnitus a horrible thing? Now, if you think about it, if you listen to this person closely, you will notice that this person is actually not describing tinnitus. This person is describing stress. I mean, problem with sleep, concentration, relaxation, enjoyment, motivation. But you don't have to have tinnitus to feel these ways. As long as you feel stressed, you'll feel this way. So in therapy, what we aim to do is to dissociate tinnitus away from negative emotions such as stress, anxiety, frustration, anger, sadness. And with these symptoms that are a direct impact of tinnitus on our lives, then we implement strategies to reduce these symptoms. So things like sleep education, sleep hygiene, setting up a good sleeping routine, relaxation exercise, attention shifting strategies, stress management, behavioral modifications, they are all very helpful for reduction of these negative symptoms that I mentioned. Now, for example, imagine if there is a tiger in this room. Let's say the tiger is a fully grown tiger sitting in the middle of this theater, unchained, okay? Just, freely sitting there. And I say to you, don't worry about the tiger. It hasn't eaten anyone since Wednesday. Okay? I don't think it will harm anyone today. Okay? Now focus on me. We are talking about tinnitus management here. Where do you think your concentration will be? Of course, your concentration will be on the tiger. You will be monitoring the tiger's every move. You'll be making sure that the tiger doesn't come close to you. And you'll probably really want to work on getting out of this room. I could be doing this here. You probably wouldn't even notice me. Why? Because once our brain registers that there is a threat, it's natural that the brain will fixate on it. And it's great that our brain is doing that because it's very helpful for survival. Now, if tinnitus is a threat to you, and when I use the term threat, I'm used in a very broad sense. It could be a threat to your sleep, it could be a threat to your concentration, it could be a threat to your quality of life. As long as it's a threat, you are going to focus on it. And so, when you focus on it, then you will perceive it more. I have a lot of clients say to me that they have a habit of checking on their tinnitus. So let's say during the day they may be busy doing something, and then they will stop and go, hang on, where's my tinnitus? And then of course they hear their tinnitus, and then they get very upset about it. So in the therapy, hopefully through tinnitus retraining therapy and cognitive behavior therapy, what we aim to do is to train the brain to become more neutral towards this signal called tinnitus, so that it becomes one of many sounds that you hear in your everyday, and that through the therapy that we become more and more neutral to tinnitus, and so that it becomes less of a threat, less important, and our perception of this sound may reduce. The therapy that we offer is a management approach, it's not a cure. It aims to reduce the negative emotional reaction towards tinnitus and to reduce its interference in our everyday life functioning, so that tinnitus is more in the background that we can easily shift our attention away from. And as we become more and more neutral towards tinnitus, then there could be the reduction of the awareness of it. So even though there is no cure so far for tinnitus, don't despair, because there are a lot that we can do to manage our tinnitus. Thank you.